So here we're going to examine the relationship and the connection between the hypothalamus and the pituitary gland. The hypothalamus controls the release of major hormones from the pituitary gland. And you may see this referred to as the hypothalamic pituitary pathway or the hypothalamic pituitary axis. So the hypothalamus is a brain structure that's located in the diencephalon, and it's connected to the pituitary gland through a stalk of connecting tissue referred to as the infundibulum. A closer look at the pituitary gland will reveal that it has two lobes, the anterior pituitary and the posterior pituitary. The anterior pituitary is composed of gland tissue, so during development it is derived from the epithelial tissue that lines the mouth. The posterior pituitary, on the other hand, is made of nervous system tissue. So during development, it forms from a downgrowth of the hypothalamus. The pituitary gland combined, so that is the anterior and posterior pituitary, secrete 8 major hormones. We see that 6 hormones are secreted from the anterior pituitary, and 2 hormones are secreted from the posterior pituitary. So let's start with the anatomy of the anterior pituitary. The anterior pituitary manufactures its own hormones since it is a gland and not nervous system tissue. The release of hormones from the anterior pituitary are very carefully controlled by hormones secreted by the hypothalamus. We will see that the hypothalamus secretes either releasing hormones or inhibiting hormones. The releasing hormones, as their name implies, will stimulate the release of hormones from the anterior pituitary. Meanwhile, the inhibiting hormones, again, as their name suggests, inhibits the release of hormones from the anterior pituitary. We will only focus on some of the major releasing hormones from the hypothalamus, and we will not discuss any of the inhibiting hormones. So here we see the connection between the hypothalamus and the anterior pituitary. Now notice there is no direct neural connection between the hypothalamus and the anterior pituitary gland. Instead, the connection is vascular. This means that the neurons in the hypothalamus produce their inhibiting or releasing hormones, and then those neurons will secrete those hormones into small capillary beds that are located within the anterior pituitary. When stimulated, the hypothalamic neurons will secrete their releasing hormones, or their inhibiting hormones, into the primary capillary plexus, seen at the top of the anterior pituitary in this diagram. Blood in the primary capillary plexus then carries the hypothalamic hormones to the secondary capillary plexus through a small set of veins called the hypophyseal portal veins. When the hypothalamic releasing hormones are present in the capillaries of the anterior pituitary, the gland cells of the anterior pituitary are then stimulated to release one or more of their hormones into the secondary capillary plexus. From there, those hormones will be carried to general circulation. This very unusual arrangement of the small series of capillary beds that are connected by the hypophyseal portal system helps to ensure that the very small quantities of hormones that are released by the hypothalamus are not diluted by systemic circulation. So the hypothalamus will secrete a very specific releasing hormone into that capillary system of the anterior pituitary, which will then stimulate the anterior pituitary to release the particular hormone that corresponds to that releasing hormone. We'll see some more examples of how this works in a second. This hormone from the anterior pituitary would be secreted into general circulation, and it will travel throughout the body until it reached its target tissue or cells. As levels of hormone from the anterior pituitary start to accumulate in the bloodstream, this is going to feed back to slow the release of that hormone from the anterior pituitary and to slow the release of the releasing hormone from the hypothalamus. So this is a negative feedback system, as increased levels of a hormone in the blood work to slow the release of the hormones earlier in the chain. So let's examine the hypothalamic releasing hormones. So as their name implies, they are all synthesized by the hypothalamus, and all of them target the anterior pituitary. We'll examine 4 of the releasing hormones here. The first is called growth hormone releasing hormone, which is abbreviated GHRH. This hormone will stimulate the release of growth hormone from the anterior pituitary. The second is thyrotropin releasing hormone, abbreviated TRH, which will stimulate the release of thyroid stimulating hormone from the anterior pituitary. The third hormone is called gonadotropin releasing hormone, abbreviated GnRH. This is a hormone that stimulates the release of two hormones, follicle-stimulating hormone as well as luteinizing hormone from the anterior pituitary. And the last hormone that we will examine is corticotropin-releasing hormone, abbreviated CRH. This is a hormone that stimulates the release of a hormone called adrenocorticotropic hormone from the anterior pituitary. So now we can turn our attention to the anterior pituitary hormones themselves. The hormones are categorized as tropic hormones because all 6 of them will target and regulate the activity of other endocrine glands. And as mentioned earlier, the anterior pituitary will produce and release 6 major hormones. The first of which is growth hormone, which is abbreviated GH. This is also known as somatotropin. Thyroid stimulating hormone, abbreviated TSH, which is also referred to as thyrotropin. Adrenocorticotropic hormone, which is abbreviated ACTH. We also have follicle stimulating hormone, which is abbreviated FSH, and luteinizing hormone, which is abbreviated LH. And finally, we have prolactin, which is abbreviated PRL. So we'll begin with growth hormone. The release of growth hormone from the anterior pituitary is stimulated by the release of growth hormone releasing hormone, that's GHRH, from the hypothalamus. So as more GHRH is released, this causes the release of growth hormone to increase from the anterior pituitary. So as GHRH levels start to fall, that will also correspond to a slowed release of growth hormone from the anterior pituitary. Growth hormone is also released during deep sleep, which is why sufficient amounts of sleep as well as naps are critical for normal tissue repair and maintenance in adults, as we're going to see shortly. The primary targets of growth hormone are the liver, skeletal muscles, bone, and cartilage. Growth hormone is referred to as an anabolic hormone, which is a tissue-building hormone. Growth hormone has both growth-promoting actions, as its name implies, as well as metabolic actions. So growth hormone has a few direct actions on metabolism, including the breakdown of adipose tissue to mobilize stored fat, as well as increase fatty acid concentrations in the bloodstream. What this will do is it will encourage the body to use fatty acids as fuel. It also spares and saves blood glucose, as well as promoting glycogen breakdown in the liver. Both of these effects help to keep blood glucose elevated, which is referred to as the anti-insulin effect, because growth hormone has the opposite effect of the hormone insulin, which comes from the pancreas. The hormone also increases uptake of amino acids into cells. And as we are aware, amino acids are required for the body to build and construct new proteins. So interestingly, growth hormone only has indirect actions on growth rather than direct actions. So when growth hormone is secreted and its levels in the bloodstream become elevated, the liver, skeletal muscles, and bone tissues will increase their production of proteins that are called insulin-like growth factors, which are abbreviated IGFs. So it is these IGFs that will then promote the uptake of blood nutrients, which is going to help build collagen connective tissues, it's going to help build bone tissue, as well as increase muscle mass by stimulating the growth of muscle by building new proteins. So next we will examine thyroid stimulating hormone, which is abbreviated TSH. This is another hormone that's produced by the anterior pituitary, and therefore its release from the pituitary is controlled by the hypothalamus. The anterior pituitary is stimulated to secrete this hormone when the hypothalamus secretes thyrotropin-releasing hormone, which is known as TRH. Once again, the relationship between the thyroid-releasing hormone and thyroid-stimulating hormone is straightforward. So when the hypothalamus increases its release of TRH, that will stimulate the increased release of TSH from the anterior pituitary. When the hypothalamus decreases its release of TRH, that will decrease the release of TSH from the anterior pituitary. So as its name implies, the target organ of thyroid-stimulating hormone is the thyroid gland. This makes TSH a tropic hormone, since its target is another endocrine gland. Reduced secretion of TSH, which is called hyposecretion of TSH, reduces the thyroid's release of thyroid hormone. On the other hand, increased secretion of TSH, called hypersecretion, will increase the thyroid's release of thyroid hormone. So we see that thyroid-stimulating hormone simply stimulates the thyroid to release its thyroid hormones. The diagram here shows what we have just discussed in the previous slide about how the hypothalamus controls the release of TSH from the anterior pituitary. When circulating levels of thyroid hormone when circulating levels of thyroid hormone in the blood start to fall, the hypothalamus will be stimulated to secrete thyrotropin releasing hormone, which is again abbreviated TRH in this diagram. This hormone stimulates the anterior pituitary to secrete thyroid stimulating hormone, again abbreviated TSH in this diagram, into the bloodstream. TSH will then stimulate the thyroid gland to release its thyroid hormones. And as thyroid hormone levels build up in the blood, high concentrations of these hormones feed back to slow the release of TRH from the hypothalamus and the release of TSH from the anterior pituitary. So this is an excellent example of a negative feedback mechanism. So next, our third hormone, we have adrenocorticotropic hormone, abbreviated ACTH. Examining the name of this hormone reveals that its primary target is the adrenal gland, in particular a region of the adrenal gland called the adrenal cortex, and it is also a tropic hormone, which means that its target is, as you guessed, an endocrine gland. ACTH is released from the anterior pituitary when the hypothalamus secretes corticotropin releasing hormone, which is abbreviated CRH. As the hypothalamus secretes more CRH, the anterior pituitary will be stimulated to release more ACTH. Adrenocorticotropic hormone tends to be released in greater quantities when we are fasting, such as when we first wake up in the morning, or when we have a fever, or when we have hypoglycemia, so that is low blood glucose. Excessive or hypersecretion of ACTH will cause a condition called Cushing's disease, which we'll explore when we examine the adrenal gland. So next, follicle-stimulating hormone, which is abbreviated FSH, as well as luteinizing hormone, which is abbreviated LH, are collectively referred to as the gonadotropins. These hormones are called the gonadotropins because they regulate the function of the gonads, which are the ovaries and the testes. Increased secretion of gonadotropin-releasing hormone, which is GnRH from the hypothalamus, will lead to the increased release of FSH and LH from the anterior pituitary. FSH will stimulate the production of eggs or sperm, which are collectively called the gametes, from the ovaries and the testes, respectively, and it will also stimulate the ovaries to produce estrogens. Collectively, luteinizing hormone, or LH, will promote hormone production by the ovaries and the testes. So that means in females, LH will promote estrogen and progesterone production by the ovaries, and in males, LH will promote testosterone production by the testes. The final anterior pituitary hormone we will examine is a hormone called prolactin. Its main target is the breast tissue, specifically the part of the breast that acts as a gland and produces milk. The hormone promotes milk production by breast tissue. The release of this hormone will be enhanced by estrogens, birth control pills, as well as breastfeeding. We also see that prolactin levels, which is abbreviated PRL, will rise just before the menstrual period, which helps to explain the breast swelling and tenderness at the start of the menstrual cycle. So now that we have finished examining the anterior pituitary, we will turn our attention briefly to the posterior pituitary. The posterior pituitary, as mentioned earlier, is a downward extension of the hypothalamus. So therefore, the tissue in this structure is neural tissue, that is composed of neurons. This is not really a gland, at least in the same way that we saw the anterior pituitary was a gland. The neurons of the posterior pituitary produce and store chemicals that are referred to as neurohormones, which reflects the fact that they are made by nervous tissue, but they are secreted into the bloodstream like a hormone. So both the posterior pituitary hormones are manufactured by the hypothalamus, and they're stored in the neurons of the posterior pituitary. So therefore, the connection between the hypothalamus and the posterior pituitary is a neural connection. Neuron axons from neuron clusters in the hypothalamus extend down from the hypothalamus two blood vessels that are located in the posterior pituitary. The two different groups of neurons that compose the posterior pituitary will create two different hormones. The first is oxytocin, and the second is antidiuretic hormone. Both oxytocin and antidiuretic hormone are transported down axons of the neurons that manufacture them, and they're stored in the axon terminals of the axons that are situated or sitting in the posterior pituitary. So in this way, these hormones are stored in neurons in much the same way that neurotransmitters are stored in neurons. When stimulated, the neurons will release either oxytocin or antidiuretic hormone into the bloodstream, which will then be carried to general circulation. So as mentioned before, the posterior pituitary hormones are oxytocin and antidiuretic hormone. Both of these hormones are amino acid based, and they are very similar to one another structurally. That is, both hormones are composed of 9 amino acids, and only 2 of the 9 amino acids in these hormones are different. And this helps to really illustrate the idea that two proteins can be very similar in shape, but have extremely different functions. Oxytocin is abbreviated OXY, and antidiuretic hormone is abbreviated ADH. ADH is also referred to as vasopressin because of its effects on blood pressure. So we'll begin with oxytocin. So its release from the posterior pituitary is stimulated by the stretch of the uterus, or by suckling during nursing of a newborn or an infant. The hormone will cause contraction of the smooth muscle of the uterus, so that is if the initial stimulus was the stretch of the uterus, or it will cause milk ejection from the breast tissue, so that is if the stimulus was suckling. The second hormone, which is called antidiuretic hormone, we've already examined a little bit in our discussion of the kidney. The primary target of ADH is the kidney. The hypothalamus contains neurons called osmoreceptors that help to monitor blood sodium concentrations. And when blood sodium concentrations are high, which usually occurs when we're dehydrated, and we've lost a lot of water but not a lot of sodium, this will trigger the release of ADH. The kidneys respond to increased levels of ADH by reabsorbing water from the filtrate in the distal convoluted tubule and the collecting duct. Also, ADH is released when blood pressure is low, because by reabsorbing water from the filtrate and putting it into the bloodstream, this will help to increase blood volume as well as blood pressure. So diabetes insipidus is a condition that arises from too little secretion of ADH. That is, it arises from the hyposecretion of ADH. This type of diabetes is a result of head trauma or pituitary tumors. One of the things that's very closely monitored when someone suffered a head injury is that their urine output and kidney filtration rates are examined closely. Those individuals who are rendered unconscious from their particular head injury can very quickly become dehydrated if diabetes insipidus is present. Notice here that this is diabetes that does not involve high blood glucose. And as a matter of fact, the term diabetes actually has nothing to do with blood glucose. It instead refers to urine output. So the word diabetes means overflow, which is referring to the urine. And the word insipidus means tasteless. So early doctors would often taste the urine of their patients in order to determine what kind of diabetes that particular person was suffering from. Since this urine has little or no glucose in it, it was tasteless, and so hence the term overflow is tasteless or tasteless overflow. Since ADH promotes reabsorption of water from the filtrate, we would expect that someone who has suffered from diabetes insipidus would create huge volumes of very dilute urine. This would create dehydration, and the patient, if they happen to be conscious, will be extremely thirsty. Alcohol has the effect of inhibiting the release of ADH from the posterior pituitary, essentially producing the same symptoms as diabetes insipidus: dehydration, extreme thirst, and the production of large volumes of dilute urine. So essentially the body is going to lose a lot of water. And these lead to the characteristic hangover of someone who has consumed too much alcohol. On the other hand, someone who is secreting too much ADH would suffer from the opposite symptoms: fluid retention, high blood pressure, and diluting of the electrolytes like sodium in the bloodstream. This condition is called syndrome of inappropriate ADH secretion. This condition can occur in someone who has had brain surgery or undergone brain surgery, or has had some kind of head injury that has specifically damaged the hypothalamus. So to wrap things up, this diagram is from the hypothalamic pituitary flowchart document that is on Moodle. It shows the major hypothalamic releasing hormones that we discussed, as well as the anterior and posterior pituitary hormones, as well as their major target organs. Here the anterior pituitary is called the adenohypophysis, while the posterior pituitary is referred to as the neurohypophysis.